Since more and more people are complaining of thyroid problems, in today's episode I will present a list of symptoms that may indicate hypothyroidism. This disease affects on average of about 5 to 10% of the general population. However, its incidence increases with age. Moreover, many cases of thyroid disease are undiagnosed. And one more piece of information, hypothyroidism is much more common in women than in men. To begin with, I will tell briefly about the thyroid gland itself and the hypothyroidism of this organ. Well, the thyroid gland is a small organ that weighs only about 20 to 30 grams. However, its size does not reflect how important it is to our body. It is a small organ of great importance. The job of the thyroid gland is to produce hormones, triiodothyronine, abbreviated as T3, and thyroxine, abbreviated as T4. In addition, they regulate the menstrual cycle, are responsible for mental performance, and affect fertility. When the thyroid gland for some reason begins to secrete too few hormones, we are usually dealing with hypothyroidism. As I mentioned, these hormones affect the functioning of the entire body, so when they are missing, it results in a wide variety of symptoms. And it is this that I will now talk about. One of the most common symptoms of hypothyroidism is chronic fatigue. However, this is not the typical fatigue we experience every day, such as after hard physical work, strenuous mental activity, or a sleepless night. For many people, it is downright debilitating, a constant feeling of exhaustion that significantly impedes daily functioning. People with hypothyroidism very often have difficulty getting up in the morning, and this is despite a well-slept night. A signal indicating low levels of thyroid hormones and hypothyroidism of this organ can also be an unexpected weight gain. And it does not at all have to be related to increased food intake and higher calorie diet. As I mentioned, thyroid hormones regulate metabolism. When there is a reduction in their levels, then the basal metabolism slows down. In simple terms, our body then normally expends less energy than usual. If we provide as many calories with our diet as we always have, it might turn out that our body will not consume it, it will store it in the form of body fat. In addition, hypothyroidism may be associated with water retention in the body, which also causes weight gain. Scientists believe that even mild thyroid dysfunction can be associated with significant weight gain and increases the risk of overweight and obesity. Of course, it is important to be aware that our body weight depends on many different factors, and thyroid dysfunction is just one of them. People struggling with hypothyroidism are also very often accompanied by a feeling of cold. For example, while most people walk around in short-sleeved shirts, people with hypothyroidism have the need to wear a sweatshirt or sweater. Cold intolerance is due to aforementioned slowed down metabolism. The human body needs thyroid hormones to produce energy, which is necessary for heat production. As a result, people with hypothyroidism very often have also a lower body temperature. Weakness, cramps, and muscle pains are also relatively common among hypothyroidism sufferers. This usually affects the thigh and arm muscles. For example, some people experience muscle pains when climbing stairs and when combing their hair. Researchers have shown that a deficiency of thyroxine, one of the thyroid hormones, disrupts the function of muscle fibers and can lead to muscle damage, resulting in the aforementioned symptoms. People with hypothyroidism can also develop peripheral neuropathy, which is damage to the peripheral nerves which carry information between the brain and spinal cord and the rest of the body, including among others the legs and arms. The aforementioned neuropathy usually manifests itself as a numbness and tingling in the extremities. In addition, individuals may develop carpal tunnel syndrome. The cause of these symptoms is probably the formation of edema, which compresses the peripheral nerves. In many cases, unregulated hypothyroidism can exacerbate hair loss. Usually, the problem affects the entire scalp, not just individual areas. Thus, there is a uniform thinning of the hair, which means that we do not always notice these changes at an early stage. Hair loss usually becomes apparent only a few months after the onset. This is due to the fact that the development cycle of human hair is long and lasts several months. For this reason, we often have to deal with the paradox. Well, by the fact that the hair cycle is long, it happens that the hair falls out at the time when we have managed to diagnose hypothyroidism and introduce treatment. Then it is the treatment that is mistakenly blamed as the cause of the hair loss. And it happens that because of this, some people give up on treatment, which in the long run intensifies hair loss. This is very important information to remember. I would also add that people with hypothyroidism also experience eyebrow loss and thinning. Symptoms of hypothyroidism also include skin changes. When insufficient thyroid hormones are produced, there is a reduced secretion of moisturizing factors by the sweat glands. As a result, the skin becomes dry, sensitive, and begins to peel. In addition, some people may experience a reduction in sweating. While we are on the subject of skin, it is also worth mentioning that people with hypothyroidism sometimes develop swelling. This is due to several factors. First, the lack of thyroid hormones interferes with kidney filtration. When the kidneys become insufficient, there is an accumulation of fluid in the body, resulting in edema. In addition, thyroid hormone deficiency reduces the formation of enzymes that break down molecules called mucopolysaccharides, which are made up of proteins and sugars. The aforementioned mucopolysaccharides, when not broken down, accumulate in the tissues under the skin and act like a sponge that absorbs fluid, which also leads to edema. What's more, in people with hypothyroidism, more than once the circulation is impaired. Figuratively speaking, blood does not move at the correct rate, which can increase the risk of fluid accumulation in the tissues. Swelling is usually localized in the extremities, most often in the legs. However, some people may also experience swelling in the face and eyes. At this point, I will also add that a symptom of hypothyroidism is also an enlarged tongue. Professionally, this condition is referred to as macroglossia. The cause of the abnormally large one is an excessive accumulation of mucopolysaccharides, which I just mentioned in the context of swelling of the limbs and face. Among the symptoms of hypothyroidism is a hoarse voice. It should be noted, however, that changes in the voice occur gradually and slowly, which means that they are usually only detected in the later stages of the disease. The hoarseness that appears is due to the fact that with a deficiency of thyroid hormones, there is an accumulation of fluid in the vocal folds. In addition, in the course of the disease in question, the thyroid glands becomes enlarged, which can cause compression or even paralysis of the laryngeal nerve and consequent hoarseness. I just said that in hypothyroidism, enlargement of the thyroid gland is observed, that is, the appearance of the so-called goiter. This condition also occurs in hyperthyroidism. It is characterized by the appearance of swelling in the front of the neck, which is located just below the Adam's apple. People with an enlarged thyroid gland may feel pressure in the front throat area and may also have trouble swallowing. There is a simple mechanism behind the formation of the will. I will briefly explain it. Well, in order for the thyroid gland to produce the hormones I discussed in today's video, it needs to be stimulated. And it's pushed into action by another hormone called thyrotropin, or TSH for short, which is secreted by the pituitary gland. When thyroid cells are stimulated to produce the appropriate hormones, but due to a medical condition these hormones are not produced, the thyroid gland is then stimulated even more strongly. Unfortunately, it is unable to meet expectations and saves itself by proliferating more thyroid cells, which unfortunately are also unable to produce hormones. And it is why proliferation of cells that becomes apparent in the form of thyroid hyperplasia, or goiter. Current knowledge also shows that changes in thyroid function affect perceived taste and smell. In one older study conducted on a small group of people, researchers noted that 39% of people developed taste disorders, while 17% of people developed smell disorders. At the same time, it is worth noting that the introduction of treatment for hypothyroidism restores the proper sensation of taste and smell. Scientists have repeatedly shown that hypothyroidism can affect various cognitive functions. People suffering from the disease usually experience memory impairment and decreased concentration. Behaviors such as forgetting where I left my car keys or not remembering what purpose I went to the other room for are characteristic of thyroid disorders. These symptoms are commonly referred to as brain fog or otherwise mental haze. Studies have shown that patients with hypothyroidism of the aforementioned organ are characterized by a reduced volume of the hippocampus, the area of the brain responsible precisely for memory, among other things. In addition, reduced blood flow is observed through brain regions involved not only in memory but also, for example, in visuospatial processing and motor speed. All these changes are largely reversible with the introduction of appropriate treatment. Constipation is also one of the symptoms reported by people with hypothyroidism. These are caused by slowed motility of the digestive tract, including the intestines. Few people are also aware that women with hypothyroidism often develop menstrual disorders. When the level of thyroid hormones drops, this sets in motion further repercussions that result in a reduced production of hormones closely involved in the menstrual cycle and ensuring the proper functioning of the ovaries. I am referring to folliculotropic hormone, or FSH for short, and luteinizing hormone, or LH. Consequently, hypothyroidism can cause irregular periods or a complete lack of them. In addition, ovulation may be inhibited, resulting in heavy menstruation. In women, low levels of thyroid hormones are also associated with vaginal dryness, which can cause discomfort during sexual intercourse. Erectile dysfunction is a symptom and also a result of hypothyroidism. It was noted from studies that up to 60% of men suffering from this thyroid disease had erectile problems. In addition, it is believed that men struggling with hypothyroidism have an increased risk of delayed ejaculation. Without going into details, these effects are due to a decrease in circulating levels of sex hormones. Foremost among them is iodine deficiency. Unfortunately, the foods we most often reach for are very poor in this component. Most iodine is found in seafood, fish, and seaweed. These are foods that do not predominate on our tables. Of course, we still have iodized salt, however, it does not fully solve the problems. I know that some people use megadoses of iodine. However, it is worth being aware that hypothyroidism can also develop from an excess of this ingredient, about which I will record a separate video. As a teaser, I will add that the use of megadoses of iodine promoted by Dr. David Braunstein is based on a reprehensible misinterpretation of a study on iodine intake by the Japanese. Dr. Braunstein's book says that the Japanese consume about 30.8 milligrams of iodine per day, almost 10 times the RDA. In writing this, the author cites a paper from 1968. I checked it out. My conclusion is that the author has misinterpreted the study he relies on. The study says that the average consumption of seaweed in Japan is 4.6 grams per day and that seaweed has 0.3% iodine. 4.6 grams of seaweed multiplied by 0.3 does indeed yield 13.8 milligrams of iodine, but this is a big but. The Japanese eat wet seaweed. And the 0.3% iodine content in seaweed mentioned in the paper is based on the dry weight of the seaweed. Since seaweed contains at least 90% water, so it provides much less iodine than the recommended 30.8 milligrams. Next to iodine deficiency, the most common cause of hypothyroidism is Hashimoto's disease, an autoimmune thyroid disease. This is a condition in which our immune system destroys the thyroid gland due to abnormal activity. Hypothyroidism can unfortunately also result from the use of certain medications. I'm primarily referring to drugs such as amiodarone, thalidomide, phenobarbital, phenytoin, carbamazepine, or lithium. Radiation therapy to the head and neck area, radioactive iodine treatment, as well as surgical removal of the thyroid gland, such as in the case of cancer, can also be the cause of hypothyroidism symptoms. To diagnose hypothyroidism, the first step is to test the level of the hormone TSH. If its concentration is elevated, then you additionally need to check the level of free thyroxine, recorded as FT4. With a high TSH level, a low FT4 level is more likely to indicate hypothyroidism. Hypothyroidism is a disease that I believe is still underdiagnosed. This is mainly due to the fact that the accompanying symptoms I mentioned in today's video are downplayed. As a result, few people see a doctor or go directly for the testing. I also know that many people simply don't have the knowledge that these types of symptoms can indicate hypothyroidism, and as a result they take no action. I hope this video will change that at least a little and you will be more discerning about your body and act in time. That's all for today's video. Thank you for your attention and see you next time.